This episode of the Beauty by AVIC podcast is brought to you by Cynosure. Hello and welcome to the Beauty by AVIC podcast, your online support community for the aesthetic and beauty industry. Here, we are strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is Beauty by AVIC. I'm your host, Stephanie Miller, and today's guest is Dr. David Kosenko for Cynosure. David graduated from Monash University in 1987 and became a Fellow of the Royal Australian College of General Practitioners in 1994. He has always had an interest in GP dermatology and skin cancer medicine, and in 2007 he branched into cosmetic medicine, subsequently attaining a fellowship with the CPCA. David serves as president of the CPCA and speaks regularly at conferences, workshops, and webinars. He has a keen interest in teaching and supervises GP registrars, mentors cosmetic medicine registrars, and teaches nursing and medical students in his clinics. He is passionate about the concept of lifelong learning, and he recognises there is a lot to be gleaned by interacting with those from outside one's craft group. Here to discuss the latest generation in HIFU technology for Cynosure, today we welcome Dr. David Kosenko. Welcome to the podcast, David. How are you today?
I'm really well, thank you. Thank you for inviting me.
You're very welcome. I always get excited when I speak with you because you're full of amazing information. And today we're going to be talking about one of my favorite topics, and that's actually a treatment that I've had recently, and that's HIFU. So for the people listening today that don't actually know what HIFU is and what it can do for patients, David, tell us a little bit about this amazing technology.
So HIFU stands for High Intensity Focused Ultrasound. It's a technology that's probably been around for 10 years, 12 years in the aesthetic field. It's been used actually in other areas of medicine probably for about 50 years. High intensity focused ultrasound, I guess the best analogy I can give you, it's like when you're a kid and you've got a magnifying glass and you got the sun to shine on it and it came down to a little narrow beam and then a spot that got really, really hot. HIFU does basically the same thing, but it does it with ultrasound waves rather than light. So the device focuses ultrasound waves to a particular depth. There's a number of different cartridges to focus to the different depths, and it produces about 60 or 70 degrees Celsius at the focal point. And much in the same way as lots of other energy-based devices, it causes a little thermal injury there, which stimulates healing, and you can get some collagen production as well as the contraction. And I guess in a nutshell, that's a really fast overview of how HIFU works.
Fascinating about the contraction in the skin, and that's to do with heat, but in particular HIFU does this very well. I mean, there's lots of heat-based modalities out there and they don't have that effect on the skin. Why is HIFU different? Why does it cause that contraction so well without damaging the tissue around it?
Again, if we go back to that analogy of the magnifying glass and the light, the focal point's quite small, so you get a fairly precise area of thermal injury there. And I mean, you can get contraction due to lots of other things. I mean, fractionated lasers can produce contraction as well, and simple microneedling can, and RF devices can. So they're all a variation on the same sort of theme. HIFU, I think, does it really well because you can vary the depth so much. You can get deeper with HIFU than you can with other devices. So some of the treatments target the SMAS layer in the face. And that, I'm always really cautious about talking about lift when you're not talking about surgery, but that can produce a lifting effect. So I think it's because of the great choice of different cartridges you have and the different depths you can treat. That's the difference. You know, things like microneedling is very superficial. Even radiofrequency microneedling is quite superficial in comparison. Fractionated lasers are all quite superficial too. So that's a real difference between HIFU, I guess, and the other technologies.
Wow, that's beautifully explained, actually. It actually clears up a lot of the questions I had. But one of those questions leading on from that is because it targets so deeply. It's obviously not just for skin tightening, but it's for fat reduction as well. Can it reduce fat? Is it used for that? What's its primary function?
I mean, HIFU certainly can reduce fat. I remember a lady that came to see me at work and started to see me regularly, was quite distressed because she'd had HIFU somewhere else. And she was a fairly lean lady and had lost temporal volume as a result of the HIFU and was quite distressed by it. And this wasn't a fat reduction treatment she had, it was simply standard HIFU. So anytime you're applying enough energy to the layer of the tissue that contains fat, you have the potential to remove fat. The ultracell Q device by Cynosure has taken it a step further, and they've developed a cartridge that does that especially, and that's its primary function. So they observed that happened with HIFU, and then they fine-tuned it to be able to get really good results.
Wow, fascinating. And so do you see that patient selection is obviously going to be a very important factor then when using HIFU? Tell us a little bit about the general consensus. Obviously, you have treated numerous patients. What is the feeling? What's the general vibe when it comes to treatment outcomes? And, what are the varied treatment outcomes that we could possibly see using this modality?
I think one of the skills in aesthetics is to be able to accurately get across the information to the person who's going to have the treatment as to what the expected outcome may be. And that's going to depend entirely on what you're trying to achieve, but also on a lot of other factors like the age of the person, for example. So if you're trying to stimulate collagen, in my opinion, it's a lot easier to do that in a younger person, let's say a lady who's in her, or a gentleman who's in their 60s or 70s even. You're starting further behind the eight ball, so to speak. So I think the main thing is to manage expectation. I think the other thing that I really discuss with them is that you're really trying to stimulate the body to make a change itself. You're not administering a dermal filler, you're not putting a neurotoxin in, which is going to give you a pretty quick effect because of the drug action, I guess, if you want to call it that. In the situation with HIFU, you're actually trying to stimulate the body into healing itself or dissolving fat or whatever it might be that you're trying to do. And that's a slower process. So I think the other thing that I really talk to people about is patience, and that this is a slow process, and it might be a 4 to 6 month journey between start and finish for whatever they're particularly wanting to try and achieve.
Okay, that was going to be another question of mine. And if I was to have a treatment today, would I need more than one treatment? Would I need to wait months and months to see the results? Do you think you see some kind of visible results after the first treatment?
Again, it depends what you're trying to achieve. So if you're trying to get some skin tightening, and let's say it's around the eyes, underneath the eyes or in the crow's feet area, you can often see a result quite quickly with that. You can see an improvement in those lines within a week or two following HIFU. On the other hand, if you're trying to get rid of some troublesome double chin fat, that's a much slower process. And, I actually have stretched out the treatments to 8 weeks between. So it's frustrating when you get back someone back too early and you're looking and you don't see much and you're trying to convince a person they need another treatment. They're going, well, I can't really see much. Why do I need another treatment? Is it going to work? Whereas if you leave it longer, it gives the body a chance to do what it has to do. And then you can say, look, you can see that there has been an improvement, but you need another 1 or 2 treatments, whatever it might be, to achieve their endpoint.
I like that, stretching out the treatments a little bit further. I think with this particular treatment, it might be a really good idea. So I have heard that could be a factor coming in too quickly. Do you feel that if you have more frequent treatments, it might actually slow down or somehow counteract the results?
I haven't really thought about that, to be honest. I don't know that it will be counterproductive, but I don't know that you need those extra treatments or those more frequent treatments to reach the same result. So you may be doing treatments that are perhaps unnecessary. And like I said, it's very important to manage the expectations of the person that you're treating. You know, they have to be on side and they have to be wanting to go along the journey, and they have to understand the process. You know, I've spoken to a few people that use HIFU, and they sometimes are just frustrated because they don't see a lot. And the knee-jerk response is to do more frequent treatments, but it generally doesn't seem to improve outcomes. And I think it may lead to frustration, whereas if you can be a little bit more laid back about it, I think often, you know, you get a better result.
Do you suggest any other complementary modalities to work in the in between? You know, it's 8 weeks for a patient. Sometimes is a long time to wait. You know, would you suggest anything halfway through?
It's funny you should ask that. At the moment in our practice, we're trialing some collagen supplements between treatments.
Wow.
And, you know, there's probably no really good randomly controlled double-blind studies to show that it's effective. But to me, it would make sense that if you're trying to stimulate collagen production, at the very least, you want to make sure you've got building blocks available for the body to make that collagen. And it's a pretty inexpensive add-on. And so we've started offering hydrolyzed marine collagen supplements whilst they're having HIFU treatments to see if that enhances the effect or not.
Leaders, innovators, developers, and best-in-class creators of energy-based aesthetic and medical treatment systems, Cynosure develops and manufactures a diverse range of leading treatment applications for hair and tattoo removal, skin revitalization, scar reduction, women's health, body contouring, and more. Always one step ahead of the industry, their innovative products are used by practitioners, physicians, and aesthetic business owners worldwide to enhance their offerings and provide cutting-edge treatments for their patients. In addition to laser and RF technologies, Cynosure Australia also provides marketing, clinical, and technical support services. Learn how Cynosure Australia can help you grow and succeed. Contact the team at www.cynosureaustralia.com today.
I'm not sure how we're going to measure it. I mean, people seem to be happy with the results, and we've had quite a few people say that they think their nails and their hair improves.
Oh, I can imagine.
Which is a nice thing. But I guess it empowers the person, allows them to do something and take part in the treatment as well. I don't think it's harmful. And like I said, it's relatively inexpensive. And I think there are some benefits from it.
I think there's a psychological element too, where you're, you know, that long stretch, that 8 weeks, is, you know, you're looking in the mirror trying to see if there's any changes, and you're kind of just sitting back and waiting. I think it gives the patient something to focus on. And definitely, like you hear anecdotal, you know, you're like, oh, there's some merit to possibly trying it out, and who doesn't like good skin and good hair and nails. I do want to ask one more question just on results, and this is something that happens, you know, as a woman, you and I get so many patients coming in with a lower face, you know, pre-jowl, heaviness on the lower face, especially myself. I've lost a bit of weight. Does it work on the lower face? You know, around the eyes, we were talking about, you know, wrinkles around the eyes and rejuvenating around the eyes. Can you risk removing that tiny bit of fat that is under your eyes? You know, what's the risk there, and what can you see with lower face, I suppose?
I think absolutely. We started with just the standard protocols, but I must admit I've been fiddling around with things. And a lot of the people I see 40 and above, and there's a lot of women in their 50s and 60s, and they tend to have jowly faces often, and they have perhaps some loose skin and double chin. So we've used the HIFU a lot in that population. And we started off treating under the jawline and getting good results. And the treatment did extend above the jawline a little bit as well. And then I thought, I'm going to focus a little bit more just on that pre-jowl fat area. And so we will do some passes in that area to dissolve the fat, and then some passes over the top to try and stimulate some skin tightening as well. Because why wouldn't you try and sculpt that as well? And I think it does help. As long as you're aware of what the effects of the treatment are going to be and the potential adverse effects as well, there's no reason why you can't do something like that. If they've got a really gaunt sort of face and sunken cheeks, then you'd have to be really cautious about trying to do something because you may aggravate it. But if you've got someone that's got those nice areas there that you
chubby cheeks,
I think it's reasonable to do so.
And could you kind of hit the lower face without removing the fat, or trying to avoid removing fat and just tightening that skin?
You can. So I mentioned before that Cynosure, in their development of the Ultracell Q Plus machine, has two different types of cartridges, and one set of cartridges is your traditional HIFU, which is a dot pattern, and the fat reduction cartridge is a linear pattern, which in effect creates, rather than a dot of heat, it'll create a large area, a linear band of heat, and that more specifically targets fat. So if you use more superficial depth cartridges using a dot pattern, you'll get more of the skin tightening and you can avoid that fat reduction.
That's fascinating. Tell me a little bit more about this linear cartridge. I think it just sounds quite exclusive to Cynosure.
Sure. Cynosure was the first in Australia to bring it to market. I think there is another manufacturer now that might have one as well. Normally, a HIFU cartridge will drop a line of dots. I think the cartridge is 25 millimeters long in their treatment length, and it'll put a whole heap of little dots in a row, and they're your little microthermal zones, and that's a traditional HIFU cartridge. The linear cartridge doesn't lay individual dots. It just lays this layer of heat all the way along that 25 millimeters. So you get a bulk heating effect rather than a specific spot of heat. And so that's far more effective at disrupting fat cells and helping the body to get rid of them.
Can you use that linear cartridge on the body?
Absolutely you can. It's been tried for under the upper arms, the so-called tuck shock balms, the areas around the side of the breast, the bra bulges. You can use it on the abdomen, although, it starts to get a little bit more difficult because the Ultracell is designed for treatment of smaller areas. On the one hand, we're talking under the eyes. So if you're going to go across the whole of your belly, it takes quite a while to do that, but theoretically you could do that. I've seen it treating the lines and wrinkles over knees. If people don't like their wrinkly knees, you can tighten the skin there. And
fascinating.
So yeah, you can use it in lots of different areas.
Upper thighs, the little pocket
upper thighs.
Wow. This is fantastic.
They're all different cartridges. So for the body, you're going to tend to use cartridges which penetrate a lot deeper than, say, on the face.
If I wanted to treat a body area, how many treatments would I need to have?
I think it's similar to the face. I don't think it's a harder area to treat necessarily. One of the things that I thought of earlier as you were talking, and I can't remember what it was about, something about seeing results, is that in my opinion, you need really good photography to be able to demonstrate these sort of results, because especially if it's 8 weeks between treatments, you can't remember yourself what you looked like 8 weeks ago. So you need to have really good standardized photography. And I think that's something that's poorly done in a lot of places. And I think it lets them down because it's really hard to show the before and after. If you're treating the body, let's say, it gets trickier. Like I know I've tried to show or demonstrate the areas under the upper arms, and it can be, even with good photography, it can be really hard to show differences because it depends on whether the arm is held up here or down here. And I guess people will often report, yes, perhaps my clothing fits better, or I don't have those lines there that I had that annoyed me before, but it can be sometimes hard to demonstrate it. I don't think you need more treatments, but I think, it can be a trickier area to sort of show the results well.
So 3 to 4 treatments on the body should do it?
Yeah, I think so.
Look, I think what generally happens is sometimes you get a general sense of looking better. You're looking at your arms, you feel slimmer, you feel like they just look better when you're wearing your dress, but you might not be able to pinpoint on the photography. With the face, do you use a facial scanning device or do you just use simple photography?
I use a Canfield Vectra system. So it looks like a SLR camera, but it's got a fancy lens on it, and software that standardizes the lighting and the exposure and the placing of the image. So I just find that the easiest to use. I mean, I can do it whether the room is bright or dark, or whether the blinds are open or not, or whether it's summer or winter. It doesn't make any difference. It just standardizes everything. So that's a system I found works really well for me.
And so tell us a little bit about the Ultracell Q Plus. What do patients, what can we expect to pay for a treatment?
One of the things about the Ultracell is that it's a really fast device. Now, I haven't had a HIFU device in the past. This was the first one I bought, but I have spoken to people and demonstrated the Ultracell to them. And one of the things that they comment upon is that, when they do HIFU at their practice with their device, it can take anywhere up to 90 minutes to do it, depending on the areas they treat. And it can be slow and it can be painful. The thing about the Ultracell is it's really quick. I can do, if we're treating the submental fat and jowls and lower face, I can do that treatment quite easily in 20 minutes. And my patients love it because it's one of the few treatments I have that are painless, which is not what
painless.
Painless. Did you find it painful?
I did not. I didn't. Honestly, I was saying to Kylie, I can't feel it. Is anything happening?
That's pretty normal.
Yeah, I was wondering for a second there. I'm like, you can turn it up. And then I did feel like once they increased it a little bit, I thought, I can feel it a little bit now, but it was very comfortable, David. I was quite shocked because I actually have had a HIFU treatment with another device, maybe about 3 or 4 years ago. It was very painful.
So because it's painless, unless you're in the wrong spot, and because it's fast, you can do it quicker and you don't charge as much because you're not spending so much time with people. So, I mean, my HIFU treatments, I guess, are around about $600. If you're doing a really large area or you're doing more complex ones, it'll be more. But, your double chin and your lower face, we charge $600.
Speaking of double chin, submental fat, any other options to treat this? I mean, HIFU's definitely going to come up as one of the premier ones. If you weren't using HIFU, what would you traditionally be doing to address that problem area?
To explain that, I sort of got to explain the path about how I ended up with the Ultracell, I guess.
Oh, yeah, tell us the story.
People coming to see me and they said, what can you do about this? I don't like this. I want to get rid of it. And there's some injectable products, fat dissolving injections that you can use. And at the time of the launch of the product in Australia, I was having a lot of trouble trying to get some training in it so I could purchase it. And so one thing led to another. I sort of lost interest in it for a while. And then I found out about the Ultracell. So
you're talking about deoxycholic acid? Is that how you say it?
I am. I think we can say.
Can we say it? I think we can maybe not use a brand name, but it's super painful.
Okay, well, so the reasons I ended up not using it and not going down that path is because you need multiple treatments. It's painful, although you can mix it with local anesthetic to reduce the pain, and generally it causes quite a lot of swelling. So people may have really swollen necks for a few days after the treatment. And, with the Ultracell, it's painless, you get no swelling, and it's fast. And, it can be cheaper than to use the injectable treatments. I guess you could also have surgery, could have some liposculpture in that area if you wanted to. Our clinic is exclusively a medical clinic, so we don't do surgical procedures there at all. So the people that come to see me don't want surgery. If they say to me, what can I do about this problem? I think you need surgery. They usually say, well, then I'm not going to treat it. I don't want that. But that's the population of people that come to see me. So anyway, that's how I ended up with the Ultracell.
Sounds good. Out of all of this, I actually started investigating the Ultracell Q Plus when we actually had our Facebook Live, David.
Yes.
We talked and I got so excited. I actually called up Cynosure, called up Kylie and said, I really am interested in having this for my clinic, but I'm actually interested in having a treatment. And she was kind enough to give me a treatment. And every time I talk to you, it reinforces how incredible this device is. Obviously, you need to use it conscientiously, have the right patient selection.
do the right things, if you do, it sounds like there are some tremendous results that come out of this wonderful treatment. And, in combination, especially with other treatments that you have in your clinic, can really provide that holistic global approach to somebody who's looking to rejuvenate their face. So I just wanted to say thank you so much for coming and letting us pick your brain. And it's always wonderful talking to you. Thank you so much again for your time, David.
Thank you very much. It's been a pleasure. Always enjoy talking to you.
All right, David, you take care. We'll have you back very soon. Thank you.
Thanks very much.
You've reached the end of another episode of the Beauté by ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.